Assalamu alaikum wa rahmatullahi wa barakatuh. Very good morning and a rainy morning in Johannesburg. It is just after 10 a.m. Channel 347 Health Matters COVID-19 Extra. Alhamdulillah, we have just a few shows left as we then wean you into the spirit of Ramadan. So watch out for more information with regards to that. I'm Khawa Solomon. Please do stay with me for the next hour as we recap you on what's happening in your environment during lockdown and in this arena of this pandemic. Firstly, we will give you some stats, what South Africa is looking like. We'll also show you some various helpline numbers, so get those pens and papers ready. Some videos with regards to today's topic, and that is Masks for All. It's a project called Masks for All, initiated by the IMA. We chat to Professor Shabir Musa, who heads up the Chowley Community Centre in Soweto, and how he got his fingers all crossed in this project. Very, very busy chat and group that wants to do the right thing for mosques across South Africa. We will be highlighting a mosque angel as well. Sumaya will be chatting to us. But firstly, let's see what South Africa's stats are looking like with COVID-19 cases. Have a look at the death toll. It's really rising. Take a look. So another high number, 247 new cases in one day, and South Africa is standing at 90 deaths. The message from government is no alcohol, no takeaway food, no cigarettes. Sales are allowed. Don't put your life and the lives of others at risk. Stay at home and report all illegal activities. This is the message from government. So as we know, level 4 has not set in yet, right? So that means that the rules of staying at home, only going out for essential services, all of that, sales of liquor and cigarettes and takeaways are not to be done. We do know that the restrictions will be lowered when it comes to level 4. So note that there is a possibility around takeaways and food places that can only deliver the food industry, the hot food industry. So do visit sacoronavirus.com for more information on government's regulations, rules and regulations during the lockdown and the various levels when they are of course, sanctioned through the time, I think the 1st of May, will allow us to see certain regulations also lowered. So to know that we need to keep sane during this time of lockdown, IMA executive member Wahida Esop had put together this lovely slogan for us, and also in lieu of Ramadan, locked out, locked down and locked away. She's saying wicked whispers, horrid thoughts, evil deeds, all this locked away for a holy month. Away with the bad, away with the ugly, devil locked away. So take a listen to this.
Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Wahida Esop, National Executive Member of the Islamic Medical Association. Days to remember. Locked down, but locked away. Wicked whispers, horrid thoughts, evil deeds. All this locked away for a month. Away with the bad, away with the ugly. Our devil is locked away.
Please note that you can interact with us throughout the show, after the show, and after hours. Our WhatsApp line is available. Take note of that. The WhatsApp line is how we communicate with you, the viewer, and everybody around the world. So tell your friends and family if they want to listen to, at least watch ITV networks, they can stream live. That is on www.itvnetworks.tv, and then click on live stream. We are on channel 347 on the DSTV platform. You can catch us wherever you are with your DSTV app as well. I'm Hawa Solomon, and we continue with our conversations around this lockdown and masks. That's today's topic, masks for all. We will be chatting to Professor Shabir Musa a little bit later on, so please send through your questions around masks, how you should wear them. And then they'll also have a very interesting chat about regulations of masks. But now we chat to the Mosques Angels, and that is Sumaya Kasim and her team. She has reiterated that she is not the only person. She might be driving and, following through and dropping and doing the necessary, but there are many, many people around and behind her when it comes to making of the mosque. So let's chat to Sumaya Kasim. Assalamu alaikum to our Mosque Angel. How are you doing, Sumaya?
Walaikum salam, Khawa. Thanks for having me. Shukr, alhamdulillah, we are doing very well on this cold winter morning.
It is a bit rainy, the barakah of the Almighty pouring down on us, alhamdulillah. And we pray that everybody who does not have the necessary coverage during this rain is protected as well. So Sumaya, tell us a bit about yourself. You're a fashion designer, I believe, and you're running this mosque project. Who is the Mosque Angels?
Thanks for asking the question, Hawa. What I started off as in the beginning, just before the lockdown, I had called a local fabric store in Indonesia. I'm from Indonesia. Okay. And I asked them, could you please get me some cotton fabric and elastics? What I'd intended doing was just to give a few of the old people, the normal petrol station, the CPF in my community. I'd intended to make masks and give it to them free of charge. Why? Because I'm a sewing instructor as well, the mask looks beautiful and wonderful. So I sent out a BC to all my students with the pattern. It was very simple. And I just encouraged them and motivated them to make their own mask. What I didn't expect or realize was the phenomenal response that I've gotten from them. Not only from them, the power of social media, we definitely cannot underestimate it. And before long, just about everybody was asking how could they help. So with a very simple mask pattern in hand, I reached out to communities by social networking, and I created a platform for not only ladies, but gents as well, with a sewing machine and a basic knowledge of sewing to volunteer their services by producing homemade masks for communities that are in desperate need, most importantly, free of charge. And that was the beginning of the Mosque Angels.
Who are you providing these masks to?
In the beginning, when we get started, Dr. Marianne Felix, a medical doctor specializing in occupational lung diseases, had donated to the cause. So we had started with her with Yoga for LX, and she helps people in Alexandria deal with stress. And she had no idea that 9 years later, she would have helped hundreds of young people from the township benefit from this program. Being this invested in Alex, Dr. Felix and her team of nurses are actually in the forefront of the COVID-19 disaster in a community where masks are provided free of charge. As well as the most important thing is she educates the people of Alex about the COVID-19 virus and the correct use of wearing the mask, and the importance of washing out the mask in hot soapy water, then rinsing it out in hot water, allowing it to dry thereafter. After the local communities have seen our work, many sponsors came on board. So at the moment, we are giving it to old age homes, the government hospitals, government clinics, or any other deserving young individual or old individual who needs masks free of charge. With the help of our sponsors, we are able to provide these free of charge.
So looking at the operation that's happening, I see men, women, and your students are all involved in this, and the overwhelming response that you have got. Is it located at various individuals' houses? Where does this operation take place?
We started actually in Indonesia. That's where I reside. We get the role of fabric. I have lots of different people on my team. It's done in a very systematic order. The roll of fabric is cut into 3 meters. Thereafter, it's given to people all across Gauteng, not just Indonesia. We cut them into little blocks. We have an 82-year-old man who volunteered his services free of charge to help us cut the mask. free of charge. Then it goes back to other volunteers who pack them in 30 pieces, which equals to 10 masks. We put our elastic in it as well, so it's all fully packaged. So whoever wants to help us, we give them 30 pieces, which is 3-ply masks. Then it's given to them. They sew it into 10 masks, which is then collected back by us. We have a team who washes out all these masks, thereby ensuring they're sanitized as well. And then they're repacked for distribution.
Are these masks for individuals? Because I see some of the health workers are also wearing it. Does that mean it's medical grade?
Unfortunately, they're not medical grade. They're just meant for the normal individual public and essential workers in the forefront.
All right. Let's look at some of the highlights of this Masked Angel project.
The highlights have been where we've given to communities where they're desperately in need. We've had beautiful thank you letters, and that's a motivation for all the people that work to be, to continue going forward and continue producing. Even though it's Ramadan, it hasn't stopped people from producing and giving up their time. They are still prepared to volunteer, even if it's just 2 hours of their time during the day. They are still prepared to volunteer, which is amazing.
Any challenges or hiccups that you've run along the road of the distribution, or any other issues?
Our major challenge at the moment is sponsorship and donation.
Okay.
That's what we are faced with. We do understand many people are tight with the budget because of the lockdown. But alhamdulillah, I shouldn't complain. We've had wonderful sponsors who without them, our volunteers would not be able to use their sewing skills to help the disadvantaged and the old, and the deserving general public who receive the mask free of charge.
So I know very soon the fabric shops will be open. Will that help your cause, and how can others also assist, how can they contact you?
My contact number is 072 733 0005. I repeat, 072 733 0005. We have an Instagram page as well as a Facebook page. It's called the Masked Angels. We are happy to expand our network, bearing in mind that there will be an ongoing need for these masks long past the end of this lockdown period.
Absolutely. Sumaya Qasim, Jazakallah for your time. Shukran so much for all the time and effort you and your team. We extend it to all the individuals that reaches out to assist you in this Mask for All, at least Masked Angels project. All the best, and may you continue with the necessary strength that the Almighty has given you, even in this holy month of Ramadan. May there be more barakah as well because of that.
Thank you. We, the Masked Angels, would like to thank ITV for hosting us, and thanks for the interview. It's
absolute pleasure. Sumaya Qasim and her team from Masked Angels, they're doing some great work out in Lens and the various spots in Johannesburg as well. Please do connect with them via their Facebook page, Masked Angels, on Instagram and Facebook page. So before we go for our quick short break, take a listen to this Masks Against Coronavirus.
The two main types of mask most widely in use are the N95 or FFP2 with a two-way protection that filters air inhaled and exhaled by the wearer. These masks can filter out at least 94% of very small particles the size of 0.3 microns, including bacteria and viruses. They reduce the risk to the wearer of both microparticles as well as saliva droplets and secretions from the upper airways. If the mask is fitted correctly, minimal leakage occurs around the edges when the user inhales. The World Health Organization recommends this mask be used by medical staff. The other protection is the surgical mask. Health authorities recommend this mask be worn by all infected people. It prevents droplets or secretions being expelled onto other uninfected people. It sometimes tends to be loose-fitting though, which means leakage can occur when breathing. Once it's been correctly put on, it mustn't be touched to prevent any possible accidental contamination. Masks should be changed regularly, every 4 to 5 hours, and used masks should be properly disposed of in the bin. Wearers must then wash their hands with soap and water or with hand sanitizer.
Welcome back, Health Matters Extra, our last few shows left of the week, inshallah, as we focus on some of the COVID-19 information we need to inform you about. Live here in the studios of Johannesburg, ITV Networks in Sandton. We appreciate your time and also contact that you have taken and informed us what is bothering you with regards to the lockdown and COVID-19. Please do keep them coming. That is, our WhatsApp line is open to all our viewers to interact with us with regards to their concerns about lockdown and COVID-19. We continue the Mask for All show today, so please do interact with us. If you have any questions, we now speak to Professor Shabir Musa, who heads up the Chowley Community Centre. But note that we are playing you various overlays of telephone numbers that you can take down, this being Talk to a Doctor. This one's available 24/7, dial *120 *394#, and all your necessary COVID-19 questions will be answered by a doctor. Assalamu alaikum to you, Professor Shabir Musa.
Wa alaikum salam. I hope you can hear me now well.
We can. Thank you so much. I know you're on the ground doing what all doctors need to do at this moment in time, and so much more from your side. So we appreciate your gracious time you're offering us today. Alhamdulillah.
Well, Jazakallah khair. I'm sorry, the language, the voice is a problem because of where I am in Shawelo in Soweto.
Yes, no, we at least we've got you. Alhamdulillah.
No problem. Good.
So, Professor Shabir Musa, you have very much involved and initiated the Mask for All project. Just tell us a bit about that.
Well, it's a challenge I think we all have. In the last few weeks, I think there are three issues that have been very challenging for me. One is that people in the health service, healthcare workers like myself and others, sitting and looking after sick patients, are struggling to have masks. And there are a couple of types of masks that people need to be aware of. There are these N95 masks, which are coned. I think they're sort of coned in the front. Then you get these FFP2s, which are sort of like a dust mask, and that's called FFP2. And then there's a KN95. These three types of masks are really very valuable and can be very wasted on people in the community, and we need them desperately, particularly for doctors to test patients. And we don't use it in the clinic for anything but that testing. We really are very strict about how that is used. We still have challenges that in the community people are walking around with it. Okay. In addition to that clinic, there's a surgical or medical mask, which has a blue front to it and is pleated. That pleated mask, which is the disposable mask, is also very valuable. And we use it in the health service itself for everyone who's a healthcare worker, mostly those who are working with these patients who are coughing. And we are actually not allowing patients people in the other parts of the clinic to use it because we really need to protect the healthcare workers. If we had to prioritize, we even would need to give patients who are coughing that mask, because that mask will reduce the spread of the virus. Now, these are coughing patients. And then the third mask is that fabric mask. Yeah. And that fabric mask, in fact, can be made with two layers of cotton and a third layer of sort of what's called spun-bound material and non-woven material. And this can be used by people in the community. And the reason when we started this off, it was actually because we had such a lack of masks in the facility that my wife was making these masks. And I said, we really need to have a campaign like this that says to the community, listen, if you have these expensive medical masks, please give them to the health service. Don't you walk around with it and waste it when in fact it's really not as useful to you as it is to the healthcare workers. And what will we all do without healthcare workers
Yeah.
who are unable to work? The second thing that we've put in this Mask for All campaign that I've tried to sort of provide steam to is that if you can make fabric masks the way we describe them, then please do. And please, as a priority, give it to us so that we can give it to these coughing patients who are walking around in this clinic right in front of me and don't have masks. Some of them too poor to have these masks. We are trying to encourage people, or on the third thing that we're trying to do is say to everybody, make masks, because these fabric masks actually do have value. Not so much to protect you from others, but actually to protect others from you. So as a principle, we are saying that if everybody wears that mask, the transmission from sick people, or even those who are not even sick visibly, but have the virus, which we know is being transmitted asymptomatically, that this virus will actually be spread less. So we are encouraging it, and I'm really pleased that over the last 2-3 weeks since starting it, that there's been quite a change of opinion in government now that they are saying mandatory masks for those who are in transport and in closed places. So my message to the whole community is put on masks, make these fabric masks. They're not difficult to work, make, and not difficult to look after, but they're very important for us to reduce the transmission. You can make them more effective so that they protect you.
Yeah.
But please do not waste the medical masks in the community.
Okay, so the message on the ground is if we do see these people wearing it, should we really approach them and talk to them about the status of these medical grade masks and what is recommended by medical professionals? Because I, as you just stated yourself, I was did a favor for somebody out in the middle CBD Joburg, and this individual, I gave them a lift, and they got in the car and they said, oh, here's some masks for you. And I looked at it and I said to him, where did you get this? This is a medical grade mask. It's actually an N95 mask. And he says, oh no, his friend's neighbor's auntie works at the clinic and they gave them, and so what is our responsibility in cases like that?
Oh, absolutely. I think that people, listen, obviously we don't want to shame people, but we should really approach people and tell them, listen, if I were you, the fabric mask is good. Please wear a mask. Please wear a fabric mask. Please, for all our sakes, please give this mask to the health service. I'm really disappointed because I find this not an uncommon thing, and I think that the health service needs to deal with it. That, somehow in the clinics itself, the masks are going the wrong way. They're not having the masks. Whether people are taking them and selling them, I really can't speak to it, but I think that's a very sad reflection on the health service itself. But we really need to make sure that the right people in the health service are having the right masks.
Okay.
Otherwise, we're going to lose doctors and nurses, and they might not even work.
Absolutely.
And then what do we all do when we need the help?
They need to protect themselves and their colleagues in this fight against COVID-19. Professor Musa, in your opinion, do you think, other countries, and there was a recent video that I actually found on the group chat for Masks for All in the Czech Republic, that they initiated the wearing of masks, facial masks, the face coverings for everyone. Everyone should just start using it and wearing it like we are doing now come 1st of May. But in your opinion, do you think South Africa started a bit late with this initiative to stop the spread?
Well, I think it's still relatively early days. If we can, get this happening, and I think government has been moving on the score for at least the last 1 or 2 weeks.
Okay.
Ever since we started, there was mention of a document being developed by government, and it was finally issued. So obviously, government has to think through the various issues, and they were not, they took some convincing, but now that they are convinced, they've issued guidelines. And I think that the effort of getting masks to everyone is something that really needs a lot of effort on our parts. Government has been reaching out to manufacturers to say, please produce these masks. But I think what is really outstanding about the Czech Republic is that from the top, they said to people, come, let's sew the mask and distribute it freely and put it up everywhere. And I think there have been pictures of people hanging it up on lampposts in the cities and, in shopping malls and the like. And people just grab one and use one. And I think that's the kind of, within 3 days, that 10 million population we're covered. If we can achieve that in South Africa, that would be really great. But I think all of us need to dig deep in ourselves, especially in this month of Ramadan, and ask, how can we make this happen? Can we get sewing? Can we donate fabric? Can we get somebody to pull it together locally and go to the nearby clinic and make sure that the poor and needy get these masks? Because that's where the spread is going to occur dramatically if we don't get them all masked up. So,
Absolutely. I have to reiterate that we have some good Samaritan South Africans, because I was standing in a queue at the pharmacy outside first to get in, and we followed safe social distancing, and this auntie in front of me sent her husband to the car, and he came back with a packet full of masks, and there were people in the queue that didn't actually have masks, and two little ones as well, and he was distributing these fabric masks to these individuals, and these two little ones actually looked like they were sick, and the parents had to come and bring them to the pharmacy, of course, to get whatever, and then sometimes the children has to come with, and there we had a good Samaritan just like giving out masks for people they didn't have. The problem that I do see is that these pharmacies are still selling these medical grade masks.
Well, I think we need to reach out. There's also lots of misinformation even amongst retailers. So I think we need a lot of education. That's why this Mask for All campaign, I've been trying to think through how do we get the right message across. Yeah. Even some of the ministers have been wearing the mask badly, not covering their noses and hanging it below their noses and wearing also the wrong kind of masks, wearing, N95s instead of fabric masks. So I think there's a huge amount of education required. I think every one of us can be part of that, educating people, pulling up, carrying bags of masks to give people.
Yes.
I think that's the kind of spirit of Ramadan. Inshallah, it will work. And alhamdulillah that people are doing such things. I think we must encourage it.
Absolutely. With shows like this, we try and inform you of how to wear the mask, what masks to wear, and what to do if you are wearing a mask. But before we take our short break, Prof. Musa, please stay online with us. Have a look at how Germans forced to wear masks on public transport amidst coronavirus pandemic. Have a look. Alhamdulillah, let's use this platform and many other conversations. If you are on the street with family, friends, we have various chat groups to get the message out of wearing the correct mask. So, Prof. Musa, just quickly, some of the questions that are coming in for sick people that are meant to be using the medical grade mask, preferably the N95. They asked, can this N95 mask be reused, cleaned, and how can they do that?
The medical mask actually is very hard to clean. So if you're wearing the surgical mask, which is a pleated, often blue or green, you have to discard it after one use, meaning going out for the day, coming back, you'll have to discard that. You can't really wash it or even keep it out there and allow it to sort of hang out and to dry. Whereas if you have what's called an FFP1, which is an equivalent of the surgical mask, you might keep that out. So we are so short of masks that we are telling doctors and students who are volunteering here that we're giving them 3 or 4 masks and telling them to rotate these masks, putting them at great risk. But that's what we are trying to do. The N95, again, these are, again, the high-end masks, the FFP2. There we are hanging them out and trying to use UV light to try and, sterilize them, but otherwise every 4 days. But in the setting of doing a test, normally it should be that every patient, every doctor using an N95 has to discard it. Here in the clinic, we've been advised, change it after 3 to 4 patients. The truth is we don't have enough of it. So the doctor is using it the entire morning with 20 patients because we don't have these masks. So that's, and what we are saying is discard it after that. If otherwise the mask is being used, sometimes 4 or 5 days, you can let it out to hang for an N95.
Okay.
The
So
fabric mask is different.
yes,
That I can explain that.
yeah, please go ahead.
Well, the fabric mask, I think that, you might be dealing with that question of how to make it. I think it's 3-ply is best, as much cotton as possible. So when you buy polycotton, try and get more cotton than polyester. And then after that, you can ask for a third layer. You can find sometimes fabric masks that allow a third layer, and you might be able to put in even paper towel that can serve as a barrier, as sort of a filter. Otherwise, you get the spun-bound material that can be used, 25, 50 grams per square meter. You get these spun-bound, and you can use them. The polyester, the outer one can be stiffer. The inner one needs to be soft. It's against your face, so you can vary that. But altogether, you can have the equivalence of a surgical mask with that material. So if you have good polyester, at least more than 50% cotton, with 25 grams GSM spun-bound, in between, it actually becomes almost as good as the surgical mask. The difference is now you can take that home and you must handle it the same way, which means don't touch the front nor the back at all, touch the strings, pull them off carefully, put them on when you put them on, but pull them off carefully, and don't touch the sides and drop them into a bag wherever you are. Or at home, and then wash them. Wash them in soft, in warm water, soapy water, that's like you would any other. Obviously, you need to wash your hands afterwards, and then let it dry. Drying in the sun is best. If you can let it hang out there for 5 hours and get the sun. In addition to that, you might be able to iron it. Please avoid putting it into the washer and the like, because if it's contaminated, you don't want to mess up, everything else.
Yeah.
So I would just take that and wash it and then hang it out to dry and then iron it. Ironing itself, depending on the materials, sometimes a spun-bound, if you have other spun-bound outers, etc., you might not be able to iron it directly, but the idea is to iron it directly. The alternative is simply to hang it out in hot sun.
Okay.
And you can change them every second day, so a pair is good for you.
All right.
Be careful of sharing it,
Yeah.
though.
Okay.
Don't share
Don't
with
share
other
the
people.
masks.
Don't share the mask.
Okay.
Yeah.
We continue our conversation with Professor Shabir Musa, based out in Soweto. Masks for all for Africa, just after this. Welcome back, Health Matters Extra. I'm Hawa Solomon, and it's a pleasure being with you. Thank you for inviting us in your homes. The last few minutes left of the show, literally. So please send through your questions with regards to masks. We still have Professor Shabir Musa online with us. But before we do that, we'll play you some videos on masks around the world. But the IMA doctors have also initiated some brilliant messages just for you. Take a look at this one.
A'udhu billahi minash shaitanir rajim. Bismillahir rahmanir rahim. Assalamu alaikum wa rahmatullahi wa barakatuhu. My name is Sister Hani Ali from the Islamic Medical Association, and I am the clinic's nursing director in KwaZulu-Natal. I am sure you all know that COVID-19 has its way of causing destruction within our communities, our families, and with our emotions. So hang in there. Staying home is not an option, but a rule for our elderly and those not within the essential services. We applaud the work done by our nurses, doctors, and everyone that put their lives at risk to save our communities. May you be blessed. Short as life is, we make it shorter by the careless disregard of rules and regulations. We all know that everything in life has a purpose. All events are blessings given to us to learn from, as is COVID-19. Thank you to those organizations who are distributing food and PPEs. We are grateful that you know that you are bringing hope and faith to our blessed communities, because the blessings of life is human connection. Please, however, know social distancing and wearing gloves and masks over your nose and mouth at all times. And this will help you through these trying but satisfying times. Please remember also the rules of hand washing for at least 20 seconds, and do not forget to wash off the soap and the tap and handles while completing hand washing. Wear very little jewelry at all times. I wish everyone reading this message well. May you be safe with the knowledge that failure is not an option, and let's be determined to succeed. This virus too shall pass, inshallah.
Shukran to Nursing Director Hani Ali for her message. Beautiful there, and literally people on the ground to make us understand that staying at home is not an option. You must, especially for the elderly. Okay, so now let's check out the masks issue around the world. First, we start with a Czech woman who sews face masks amidst this shortage. Another is an ex-Mexican wrestler turns wrestling masks into protective masks. Take a listen.
No, možná ještě člověk ušije nějakou jako... Tak protože jich je nedostatek, všude se o tom píše a je vidět, že i na sociálních sítích se hodně lidí do toho zapojilo a vyrábí je po domácku.
Jo, tak prostě ten kilometr už...
Ne, aby nám to vycházelo, víš, až zbytečně
to... Protože v kryčevském salonu používám klasické kryčevské techniky, to znamená, že hodně šiju v ruce, stehuju, kličkuju a tak dále. Když to tady je to opravdu o rychlosti, o tom toho udělat co nejvíc, aby to co nejvíc drželo, a nějaký design nebo propracovanost se tady vůbec neřeší. Takže...
Tak proto jsem to teď včas ještě jako to...
Tak to bylo zase.
Unos 4 nada más, ¿no? No sé cuánto sacó. Hay 5. Cualquier niño, me coses ahorita 2 Atlantis. Y gracias a Dios a mí me tocó que ahorita, pues mientras esté la pandemia y a la gente le esté gustando esto, pues seguir trabajando para la gente.
So there you have it. We do have another video to play for you, how a Taiwan inmate makes face mask when this virus outbreak started. Take a look.
来会客的时候跟我说外面口罩好难买，当我听到这些话的时候，我跟我的家人说，爸爸在里面有做口罩，也许我做了那一份口罩，你受惠得到，享用得到。当我做了这份口罩，我就在想，我一边在缝纫的过程当中，我在想，这份口罩可能可以带给我的家人一份安全。15跟15，你看会客嘛15哦，他开都用了。
Well, Welcome back to Health Matters Extra, and literally just a minute or two left to wrap up the show. We still have Professor Shabir Musa, who heads up the clinic, Chawelo Clinic out in Soweto, online with us. So Professor Musa, looking at sort of this, okay, before we do Professor Musa, let's just note that we have various massages that we do initiate during COVID-19 time. The lockdown, these masjids are not being visited. So this one we are featuring today is Masjid al-Ishraq. Masjid al-Ishraq is based out in Grassy Park in the Western Cape. Please donate generously to the various masajids that are in your area and across the board, so they can still also initiate various funds to their, to their projects and to what they need to be built for. And these must still need to run. Masjid al-Ishraq is today's feature. They're out in Lotus River, Grassy Park. Okay, so to wrap up, also note that we have various helpline numbers. Please, this one is specifically for our medical staff. So if you have any family, friends, neighbors that are in the medical industry, please take down this number and send it through to them. Note that any messages, any numbers, any of the videos that you've missed and you'd like us to send them to you, please do WhatsApp us on our communication line, the ITV WhatsApp line, and we'll send those various individual notes that you have missed through to you. So Professor Musa still online with us. As I mentioned, literally a minute or two left for the show, Prof. Let's quickly understand, as we can see, the shortage of masks is happening around the world. How can we, and I've seen the chat, the Mask for All Africa chat has been very busy. How can we as community members, as individuals, still help with the shortage?
Well, as I said, at the beginning, I think if you have medical masks, please donate them to the health service. They need it desperately. If you can make masks or help donate towards the making of fabric masks, I think that that would be really great. Please endeavor to do that and make it or get it made. Deliver it first to the clinics. Tell them to use it to cover up sick patients. And otherwise, just get everybody and anybody wearing masks whenever they go out. I think fabric masks has become the new fashion. Yeah. And remember that it's about I protect you and you protect me. It's about social solidarity. It's about Islamic community. It's about Ubuntu. Let us help each other and save South Africa. Wear a mask.
Mask for All Africa project, how can people get in contact with them and initiate some sort of advice or just a message or actually make some masks?
Yes, I think that they can go on to the website profmusa.com. You'll see a Masks for All in Africa. We're busy getting the sort of proper website up soon, so you'll find a link there. So we have the website maskforall.africa that you can also get to in a few days. So please use that to try and contribute. On the profmusa.com Mask for All in Africa, there is a link to the WhatsApp groups, so you can join it. There's even groups across the country where you can join in your particular locality, in your district. You can figure out where it is, join it, and begin the conversation there. Wherever it is in the country, how can we help? And join that conversation. Yeah?
Jazakallah, shukran so much for your time, Professor Musa. All the best. We'll definitely chat soon. Be well, and may the Almighty continue giving you guys the strength on the ground to do the work that our healthcare workers are doing, inshallah.
Ameen.
All the best.
Shukran,
and Ramadan Mubarak to you and your family, inshallah.
Ramadan
yes.
Mubarak.
Definitely keep you and the rest of your team in our du'as here at ITV. Note, go to profmusa.com, click on maskforall.africa, and you can find out the various information. Join the groups in your area. And just spreading the word of the correct mask to wear is you doing something. That is you being a humanitarian, spreading the word of not wearing medical grade masks and actually wear the face coverings or the fabric masks to all individuals. Buy in bulk and carry it in your car, and you see those that don't have, distributed to them as well. Tomorrow we focus on the deaths, the deceased, the undertakers, those that are burying our Muslim COVID-19 patients. So watch out for that one. That's tomorrow, same time, same place. From myself, Hawa Solomon, and our team. Wassalamu alaikum and goodbye for now.